We just talked about muscle cramps, muscle flutter, muscle twitching, muscle irritation, muscle pain in relation to potassium, magnesium, and a few other things. Now I'm going to split this up and talk about calcium, an easy test you can do to check if maybe you don't have enough calcium in your muscles and therefore you wouldn't have enough calcium in the soft tissues. So the products that I would use are calcium lactate, not some other form of calcium, and Cataplex F. So if you don't have enough calcium, you can take a blood pressure unit like this to check it. You can put this around your calf. Now, you don't use a blood pressure unit like this. This does not work. It has to be a good old-fashioned blood pressure cuff. And you put it just around your calf, the meaty part of your calf, not way down at your ankle, and you pump it up. You should be able to pump it up to 240, and if you get to 240, that's where your muscles should start cramping and you start getting pain. If it's 220, that's sufficient. It's adequate, but it's not the best. We want 240. If it's lower than 220, where you say, man, that's just really tight, it's cramping up, that just hurts, then you are calcium deficient in your soft tissues. That's where we test that. We test it on the calf. And therefore, you can get muscle cramping. So when you lay down at night, and you might feel leg cramps, restless legs, any of that, that might be your problem. So you use the calcium lactate. It's a soft calcium. Can't cause any problems like kidney stones. It's very soft calcium. And you use a Cataplex F, which is essential fatty acids, to drive the calcium to the soft tissues. Now, it might take some time. It's got to drive it. It's going to take it to the most important areas it needs first, and those aren't the muscles. So you got to give it a little time. But when you just continue to do it, it works. If you do it on your own and it doesn't seem to be working or something's up, then call the office. But that's how you do it. You just check it with the blood pressure cuff, and we want at least 220, and then the muscle will start getting tight, painful tight after that.